Hi, in today's video, we are going to talk about why do wisdom teeth cause problems and should you get your wisdom tooth removed or not. I'm Dr. Satish Kumar. This is SK Smile. Our aim here is to help you smile. Wisdom teeth are called so because they erupt between the ages of 18 to 24. That's when you are considered an adult or become wiser. It has no connection with the brain as such. It is also known as the third molar. Now, why does it give us all such problem? The reason being, our ancestors used to eat a lot of hard and coarse food. They had bigger jaws, so they needed this extra tooth to help them. Nowadays, our food has become extremely soft and we cook and eat them. So the need of this teeth has reduced. Hence, our jaw sizes are shrinking. But this extra tooth does not have place to come in the jaw. That is why when it erupts or it comes out, it gets a lot of trouble to a lot of people. Now going to the part whether you should remove your wisdom tooth or not. We divide it into three different categories and in each category I'll explain whether you should get it removed. The first part is when the wisdom tooth is completely erupted, that is the crown or the head portion of the tooth is seen in the mouth. Now, if the wisdom tooth is completely erupted, it helps you in chewing. There's no pain, no discomfort, and it is completely useful. Then you should not get the wisdom tooth removed. But after eruption, that is, if it is seen in the mouth, but if it is tilted towards your cheek or your tongue, and it is continuously traumatizing or irritating you, if it is causing food to get stuck between it and the front teeth, there are chances it can lead to cavities in the tooth in front or in it itself. If there is no opposing or the tooth in the opposite side, due to which it is continuously moving upwards or downwards, in these cases, we as dentists would usually advise you to get the wisdom tooth removed. The second condition is when the tooth is coming out, that is, it is erupting. Should you get it removed or not? The points you need to consider is if the tooth is coming in a straight line and you have the tooth in the opposite side, it is not causing major discomfort or a swelling or an infection, then you can save the tooth. However, while erupting, there are chances that a small patch of tissue or gums from the portion behind it would be coming in between it and the opposing tooth. While eating, you have to be extremely careful because if you bite on it, it is like biting on your own finger. So, what care do you need to take? You should keep the area clean. You can use a mouthwash or warm saline rinses. See that there is no food getting stuck out there. Even after doing all this, if the flap keeps on coming up, you have to get it removed. At SK Smile Dental, we remove that tissue portion using a laser. The advantage is it is less bleeding and less discomfort to the patient. But if it is irritating, see that you get that tissue removed as soon as possible. So the bottom line is, when the tooth is erupting, if you are sure it is not going to cause any problem, you can keep the tooth. But if it is tilted, it might cause damage to the adjacent teeth or any other structure. Then when a wisdom tooth is erupting or coming out, we advise to get it removed. Because if you do not remove them, they may cause various other problems like food lodgement, infection, swellings, cysts, and at very rare chances, a tumor. Before you see the third condition in which you might have to remove it or save the tooth, if you're liking this video, please do not forget to hit the like button below. And I'm sure if you love taking care of your teeth, you'll enjoy our channel. So do not forget to subscribe. Now the third condition is when the wisdom tooth is completely hidden within the gums and the bone and is not seen in the mouth. If it is not causing any discomfort or any problem as such, we do not advise our patients to go in and remove it out because it might cause unnecessary trauma and strain to the surrounding structures. But we would also advise you to keep a regular checkup done where you get a small radiograph that is known as an IOPA or a full mouth x-ray which is known as an OPG to see that there is no internal changes occurring around that tooth which is stuck within the bone. That is also known as an impacted tooth. The changes which can be seen is usually a fluid-like structure forming around it, or it is moving in a direction where it can damage the roots of the adjacent teeth. In such cases, then we advise to go in and pull that structure out. Now, if you're planning to get your tooth removed, we have already made a video of the instructions which you should follow once you remove them. So I would advise you to go and check that video out before your extraction so you are already sure what you're getting into. So do not forget to go and check that video. I'm Dr. Satish Kumar. This is SK Smile. Our aim here is to help you smile.